Welcome back to our study of mind rubrics. And the rubric that we are going to study today is a very small rubric, that is closing eyes ameliorates. And I think there is not much to explain with regards to the meaning of the rubric closing eyes ameliorates. That's all that can be said over here. So basically, there are two remedies that Dr. J.T. Kent has given in his repertory, that is Kalikarp and Zincum metallicum. Hmm? Now, the first remedy, that is Kalikarp, there are quite a few references available in our repertory and Materia Medica, where you see the main symptom that comes up is um, dullness of mind, difficult thinking. Doctor, I am not able to think clearly. I feel dull, sleepy, drowsy. Huh? And if only I close my eyes, then I am able to think clearly. Then I am able to process my thoughts. Otherwise, I'm kind of lost with no thoughts. This kind of thoughtless feeling, confused, dulled mind, difficult thinking, which is ameliorated by closing eyes. This is what is Kalika, dull thinking ameliorated by closing eyes. Another important symptom with regards to this is photophobia. So, photophobia, where patient um, feels that there's a lot of light, he's very sensitive to light, and is compelled to close eyes. So, patient always has to keep the eyes closed. He is always compelled to keep the eyes closed. In fact, there is one more rubric which says catarrhal fever. Catarrhal fever with photophobia, which is better by closing eyes. So during fever also, patient feels that he needs to close the eyes. If he closes the eyes, then his fever symptoms too seem to reduce. Okay, that is what is the references of Kali Carb for this rubric. The next remedy is Zincum metallicum. Now, very interestingly, I have not been able to find any reference anywhere about why Zincum metallicum is given under this rubric. Other than Kent's repertory, it's not given in any Materia Medica. At least I was not able to find. If some of you find some reference, please do put it in the chat. But most probably, my theory is most probably because of Zincum metallicum being a brain fag remedy, where the patient is not able to think anymore, is not able to comprehend things, has completely exhausted himself. Brain fag. So, Zincum metallicum, because of the metal element, there is this aspect of long continued prolonged exertion causing exhaustion. Like, for example, if you are a professional athlete and you are playing for very long hours, for many days, months, preparing for a competitive exam, and you have put in hours and hours of hard work for months together, sometimes even years. This kind of long continued over exertion, lot of exertion, no, at least 5 hours, 10 hours a day you're studying, this kind of long continued exertion followed by brain fog and um, brain fag, where the brain now is sort of not able to work properly. That is what is Zincum metallicum. And because I feel the Kali Carb also has this difficult comprehending and um, mm, difficult thinking, etc., I think Zincum met also has that similar symptom, and that is what is ameliorated in Zincum metallicum too. But as I have already said, I do not have a very clear reference or clinical experience to confirm the same, right? So that's what I have for you today. It's a very, very small uh, rubric, but because it's in the list, I couldn't just pass it off and go to the next rubric. So this is what I have for all of you today, friends. I hope to see you all soon in the next rubric. Till then, bye bye. Please do write your suggestions and comments in the chat. Thank you.